Okay, so I just wanted to review a little bit from last time the way that blood flows through the heart. Um, so I'm going to use uh, reddish for oxygenated blood, blue for deoxygenated, and just kind of walk you through the steps um, as blood passes through the heart. And then we'll talk about the conduction system in just a minute. So blood comes from the body down through the vena cava and into the right atrium. Okay, once it collects in the right atrium, the heart beats, pushes through the tricuspid valve into the right ventricle. Remember, this is the ventricle that's sort of not very robust and not very muscular, because it's only going to send deoxygenated blood from the ventricle out through the pulmonary artery to the lungs, which I didn't write on here, but I will. So then, at the lungs, blood gets oxygenated and it travels back toward the heart through the pulmonary vein into the left atrium. So then when the heart beats again, it pumps down through the bicuspid or the mitral valve and then out through the aorta out to the rest of the body. So vena cava, right atrium, right ventricle, pulmonary artery, pulmonary veins, left atrium, left ventricle, aorta. It's the basic steps, and you can find probably a gazillion, without too much exaggeration, a gazillion examples of this in if you look online if you want a better better picture. Although that is some quality craftsmanship, I will tell you. All right, so how does this all happen? The heart muscle needs to beat in a very particular rhythm in order for the blood to effectively move through the heart and through the body. It has the valves to help stop backflow, but it's also got to be pumping in a coordinated fashion. So that's what we're going to look at next, how it does that. Okay, so in order to pump in that concerted rhythm, the heart is controlled by what's called the intrinsic conduction system, or sometimes it's called the nodal system. What that does is it supplies electrical impulses for contraction. So if you think way back to when we talked about the way muscles contract, remember they need a stimulus from a nerve, and then the signal is sent, and the action potential tells the muscle to contract. In the heart, that system is a little bit more locally controlled. The autonomic nervous system mediates the rate of heartbeat. So if you get your sympathetic nervous system gets activated because you're scared, then the autonomic nervous system is going to speed up the rate. But the intrinsic conduction system keeps your heart beating all the time, basically, and in a concerted rhythm, which is really important. So there's special tissue that sets the pace of the heart, starting with what's called the cyanoatrial node. So that's in the right atrium. That is the pacemaker of the heart. So you might have heard of people having an artificial pacemaker. A lot of times it's just called a pacemaker. But that is sort of taking the place or enhancing the activity of the SA node. So the signal from the SA node travels to the atrioventricular node, which is at the junction of the right atrium and ventricle. So it's going kind of from up here at the top of the right atrium down to where the tricuspid valve is, that kind of area. And then there's what's called the bundle of His that then branches to both the left and right side, and Purkinje fibers that kind of come up and wrap around the heart on both sides. And so the signals, the electrical signals, are sent in order so that the heart beats in the correct order. Atria, then ventricles, then atria, then ventricles. So here you can see pictures of what I was just talking about. So here's the SA node, here's the vena cava. SA node is here, so that sets the pace. The signal conducts to the AV node, and then that travels down through the bundle of His, and then the Purkinje fibers kind of branch out all around the heart. So the atria can contract, and then this signal will tell the ventricles to contract. Notice again, we're still seeing really robust left side of the heart, less robust right side, because it's just going to the lungs. Here it's going throughout the whole body. You may have had, or you might be familiar with, a way of measuring electrical conduction in the heart. So a way of monitoring this is called an echocardiogram, an EKG, or an ECG. EKG comes from the German translation, but they're both used interchangeably, so don't let that confuse you. What that does is it's a way of measuring the heart's electrical activity. So they put little leads on your chest, and electrical current from the heart can be detected on the surface of the body, which is pretty cool if you think about it. So that can be a way to tell if the signals are being sent in the correct coordinated fashion. You might remember we did this for muscles as well back. God, it feels like forever ago. But we did a similar thing looking at the electrical activity of muscles back in the fall. So this might seem a little bit familiar to you. So EKGs, healthy EKGs, have a very distinctive pattern. And again, if you watch any sort of medical show, you might have seen an EKG there as well. You've got a P wave, the QRS complex, and then the T. And you can see it's repeated. So the beating is repeated ad infinitum. There are two conditions that can affect or can be caused by incorrect signaling of the heart. There's atrial and ventricle fibrillation, where the heart is not beating, it's just kind of quivering, almost wiggling, not squeezing. So this is an EKG from someone who's in ventricular fibrillation, or VFib. Again, if you watch medical shows, you might have heard that term. So you're not getting that nice patterned activity. You're just getting a squiggle. That's bad. So what does the EKG tell you? What does it show? So again, I'm telling you this because I want you to have heard it. I want you to be familiar with these terms. If you ever have to get an EKG, or someone in your family does, you'll have some understanding. The way this year is gone, this is not something that you're gonna have to know super duper well and explain. You will have to label for me an EKG, but that's about it. But here you go. So the P wave is for atrial depolarization. Okay, so that's starting the atria contracting. The QRS complex, so that like is ventricular depolarization, and then all of that impulse travels around in the Purkinje fibers around the ventricle, so the ventricle can contract, and then the ventricle is repolarizing then in the T wave, and then the heart is at rest between the T and the P from one beat to the next. So starts in the atrium, moves to the ventricle, ventricle resets, ready to beat again. Okay, so here again, you can see there is the P, so the atria depolarizing, the ventricle, and then the ventricle resetting, and then just at rest. So if you go on and study like cardiology, for instance, you'll learn sort of values for each of these, and those can tell you something about the way a person's heart is beating, if it is taking too long, or if it's too long in between beats, or all of those kinds of things you could tell from an EKG if you were a trained EKG technician. So all together, the heart beating, the blood flow that we started with, plus that electrical conduction, make up what's called the cardiac cycle. So it's all of the events associated with blood flow through the heart during a heartbeat. Both the electrical events and the mechanical, like the actual physical squeezing of the muscle. And to get a complete picture of the way a person's heart is working during a cycle, the EKG can tell you one piece, it can tell you the electrical piece, but you would also need to listen to heart sounds, monitor blood pressure and blood volume, all of those things to really get a complete picture of heart function. So when the heart beats, the atria and the ventricles beat separately. If you've had your blood pressure taken recently or not so recently, you might remember that there's two numbers. There's a diastolic and a systolic number. And so diastole is when the atria are squeezing, and then systole is when the ventricles are squeezing. So diastole should always be a lower number than systole. In here, this is a nice picture that shows how the blood is flowing through the heart. Okay, so diastole, the atria are squeezing blood to fill up the ventricles. And then the ventricles will squeeze blood out, and then everything relaxes to get ready to do it again. If you listen to a person's heart, like with a stethoscope, if you've heard that before, I'll find a link to, you can hear the sound. What you're hearing is the sounds of the valves closing. So the lub sound is from these AV valves closing, and the dub sound comes from the semilunar valves closing. And that's what a normal heart sounds like. Lub dub, etc. I'll find an example and post it in Schoology. So when we're thinking about the electrical conduction in combination with that, with the cardiac cycle, the SA node fires when the right atria stretches, when it's filled with blood. That's what sends the signal for the electrical signal to fire. So it's really a complex system all working together to make sure that the heart keeps beating and moving blood promptly through. Fun facts. Your whole blood supply passes through the body about once per minute, which is pretty fast. Remember, it's about 5 liters of blood. And the average person could fill an entire Olympic-sized swimming pool with like the amount of blood that pumps through your body every week. Swimmers, I know you know, that is a huge volume. So that concludes the cardiac cycle portion of heart anatomy. The last section is going to be on blood vessels, another structure and function illustration. Yeah, so when you're ready, part 3.